Perfect. So what I'm hoping to cover today in the training session is an overview of Kindred PHR. Many of you might be familiar with it. This would be a form for us to formalize what the overview, the features are of the personal health record, and then also how clinics can get Kindred PHR, how general users and patients can get a Kindred PHR account, and then we'll actually do a demo of the personal health record and the associated clinic application. And over the next few slides, I'll explain what the difference between those two are. So our inspiration for creating the personal health record is really to bring the patient at the center of their health journey. And one of the areas that we're obviously interested in focusing in is integrating the patient fully into the primary care services. And we recognize that the patient has, or the person has, many touches with the healthcare system, including, hospital services and community and social services that they are receiving care from, and then, of course, their personal support network. So we've started to pull information from a few of these areas into the personal health record, but this slide is really presenting the overview of what we would love to see accomplished at a large scale in a connected vision for a person. So that's more of the inspiration behind the personal health record. If we were to look at the features of Kindred PHR, there's 3 distinct features that are available to the end user and the clinic. There's secure messaging, data sharing, and appointment booking. And you'll see just below data sharing, I've listed very clear elements that are integrated with the OSCAR EMR system. So we've got full integration with documents, immunizations from the preventions module, allergies, medications, lab results, and health trackers, which are a few of the built-in measurements within OSCAR. And then, of course, we've got the appointment booking module, which allows users to book online with their clinic, but also to, for the clinic app tool that I had mentioned in the beginning, it allows clinics to configure what types of appointments they would want to make available to their patients. So we've fully put that in the hands of the institutions to be able to customize what they would like their appointment booking experience for their end users to be. How clinics can get Kindred PHR. So currently, the process is that the clinic would receive what we're calling a clinic account, and then they would also receive a URL in which they would be able to enter in the clinic account username and password, which would then walk them through connecting this clinic tool into their OSCAR system to be able to do 2 things. One would be to configure appointments that they would want available online, and the second would be to generate and manage clinical PHR accounts. So clinical PHR accounts are PHR accounts that are going to be created for any clinician. We recognize that essentially we will not be authenticating clinical service providers, so we have given the clinic the ability to credential, very similar to how they would be creating an account within OSCAR. For any clinician who works at that site, they can create a PHR account for any clinician at their site. And then for the end user, the patient can get a Kindred PHR account in 2 ways. They can either be registered at the clinic through OSCAR for their account, or they can self-register on kindredphr.com. So we've, again, enhanced this to be open-ended in a way that it best fits the clinician's workflow and the clinic model. So if at any time you have a specific question, feel free to type in and ask me the question. And this is all I have for slides. What I would like to do now is actually switch over to the personal health record and give you an overview of what that looks like. So you should be able to see the Kindred PHR homepage on my screen, and this is available through kindredphr.com. You'll see below where it says sign up that any general user can sign themselves up. I've got a patient who already has an account, so I'm going to sign in with their credentials. This is what the patient's experience looks like. So for Dave Smith, he can, once he logs in, have an overview of what his recent activities have been, which are any activities that have taken place within his personal health record, either by him or anyone who supports him in his network. So that could be a clinician or an extension into his quote-unquote informal care network, which would include family members and friends and more of a personal support network. There's also an area available to have a view of who is supporting this individual and who this individual is supporting. So supporting refers to, supporting is the individual that Dave Smith is providing care to. So in this case, it might be a spouse or a child. And when they click on the specific individual's name, they're actually launched into this individual's account. And the supporting ability is provided on a user-to-user basis. So as a user, you would have to grant another user the ability to manage certain information on your behalf. And once that's done and the user has accepted, they can now interact with your health record and manage it in a way that you've permitted them to. Upcoming events are any calendar events that are coming in the next week or so. This individual doesn't have any, but I can add something in just so you can have a look at what the experience looks like. If this user were to go to the podiatrist, they can enter that information in themselves. And I'll actually quickly flip back to the calendar to highlight the difference in an appointment that was booked using a personal health record versus the one that was entered in manually. So you'll see anything with the light background is an appointment that was booked using the booking appointment feature within Kindred, and anything with the darker background is appointments that have been entered in by the person. There's health service organization, which is any organization that this user has been authenticated in and connected to. And the health service organization news is affiliated news with the specific organization. So a user can have as many organizations as they are connected to who have enabled the Kindred PHR connection. So it might be a walk-in or a family practice or a specialist clinic if they've entered that information, if they've authenticated the patient. There's health trackers, which are trackers that the patient has entered information into themselves, or ones that have been integrated with Oscar. So we've got the blood pressure, blood sugar, A1C, glucose, height and weight, all integrated with Oscar, and the walking, sleep, and some of the other ones this user has created are self-generated. So we've got a mixture of information coming in from multiple sources. If I were to click on the health service organization, it would launch me into the booking appointment feature for the specific organization. There's also a quick link to booking an appointment up on the top left-hand corner. So this is a family health center that Dave Smith is affiliated with. There's some details about the various teams within this clinic. There are details about specific individuals who can be added by Dave that are part of this clinic as his clinical team. There's a list of an appointment history that this individual has had, and they, of course, have the ability to book the appointment. So once they click on book appointment, it will ask them for a reason and then present appointments based on the clinician's time. And following this presentation, I'll pass the presenter rights over to Jay, and he can show you the clinic tool that the clinic uses to make these appointments available and its integration with Oscar. So I'll click on the 2 p.m. appointment and just go through and book it. So this will give me a confirmation that the appointment's been booked and take me back into my clinic application, which will then show me that if I need to, I can cancel the appointment. So it is a one-click cancellation. So we're going to move on to the chart feature, which is where bulk of the information, the health information for the patient sits. And we've got current medications, allergies, and health trackers on the summary page. And this is just a quick view into the information available in those modules. If we were to click on allergies, we'd see that there is some information that this person has entered in, and the user has the ability by clicking on the blue plus sign to enter in further information or receive that receive the information from Oscar. So I'm just going to pause here. I just got in a question over Join Me, and the question is, can the cancellation of an appointment be limited to more than 2 hours, more than 24 hours prior to the appointment time? And the answer is yes. So when Jay shows you the clinic tool, he will show you the various rules that can be put in to make the appointment structure most customizable to you, so you can cancel and even make appointments available within a certain period beforehand. So for example, at the McMaster Family Health Center, they use the PHR for same day appointments. So for them, appointments can only be booked 24 hours in advance. And there are similar algorithms for cancellations. So I hope that answered that question. And I'll go back into the PHR. So I was leaving off by saying that depending on where the source of the information is, it is clearly outlined in the added by column. So in this one, it does say that this has been added by myself. However, if this information was coming in from Oscar, it would have the authoring provider listed on there, and I'll be able to show that actually in the document section. So within the documents, this person has received a certain amount of information, and most of it's been from their physician, John Henry. So you'll see here that it's fully authored, and they also have the ability to annotate information. So for example, there was a report that came in and John Henry sent it in with an annotation, and the patient themselves can write a little note in here, or if they are looking towards a specific team that is part of their circle of care, they can write certain information if the patient's provided them the ability to do so, so if they have the permissions to do that. And then as I go on, you'll see that there's been some additional information entered in from another author, Connie Smith, who this patient is given permissions to contribute to their health record, and they've uploaded some information in themselves. So the documents are through, again, very similar to the allergies functionality, where you click add and you'd be able to enter in any files, and it supports all kinds of files, so it's not just limited to PDFs. The immunizations, again, are very similar workflow as allergies. There's information that is entered in by the patient, very similar workflow, or have the ability to receive this information from within OSCAR, and that is closely integrated with the preventions module. There is a journal thread that we've created, and this is to encourage patients to monitor their health journey and be able to document whatever their health journey is or their health experiences are in a plain text format, essentially, with files, any that need to be uploaded. And this is specifically for the patient. This information does not integrate back into the not into the OSCAR EMR. But if the patient has given access to certain individuals to access this information, they can, including providers. Medications, again, very similar workflow where there are medications stratified by all current or previous and from within certain time frames. So patients can go back if they have entered in medications from a certain amount of time. The list will show that appropriately, and again, they have the ability to add in any information themselves, or as you can see here, receive information from sources that they have authorized to be able to author within their health record. We've got health trackers, which come in with a few built-in ones, which are blood sugar, height and weight, blood pressure, and A1C. So those four come built in, but there is the ability for users to add and edit their own trackers. And you can see this user has entered in certain ones like sleep, energy level, and walking. So I'll just click on blood sugar. And these are organized by most use. So this will look different for every user depending on how frequently they use a specific tracker. So if I click on blood sugar, you'll see that there's a list of data previously available, and there's two views. There's the clear data view, or there's a graphical view into this. The person can, of course, go back to their data view, and then they can add in more information if they are tracking this regularly. They can add this information in. And then I'll just show you what a custom tracker looks like. It looks very similar to the built-in trackers, but it's just a custom category that a user can enter in if it's not available elsewhere. And they would do that through the add and edit trackers. So if they were to click on add and edit trackers, new entry, you can create a specific tracker with units and goals and a brief description if that's important. So we had seen the calendar. I'll switch over to the messages. Messages, this is a secure messaging system, so ability to receive and send messages. There is the ability to add any attachments, and it's important to note that messages are not deleted from the system. At most, a user can archive it, and that's just been designed more to provide assurance that if there was an email a secure messaging trail between a provider and a patient, that's not completely lost. And then on the OSCAR side, this is also available for a provider to make part of the medical record if they so choose. So if there's an important email, a secure message dialogue that they would like to capture as part of the patient's e-chart, they do have the ability to do that. And I can quickly flip over to the OSCAR side and show what those touch points look like. There are connections. So connections are any users that either are connected to the individual or are requiring a connection to the individual. And then the existing connections are stratified by supporters and supporting. So supporters are individuals who this person is looking towards to receive support. So this might be a clinician, a child, your clinic, your spouse, etc. And then supporting would be who this person is providing support to. So in this case, it would be a child or whoever is within your personal network that you would like to, that you are supporting in their health journey. You'll notice here there's a refer a friend button, which essentially allows a user to enter in an email and send a referral for using the PHR to anyone in their personal network. So for example, if I wanted my brother to have access to a certain amount of information in my account and he didn't have a PHR account, I could send him a referral for him to sign up for one. And then the connection requests are requests by users who are interested in connecting with you for the purposes of either sharing data or secure messaging or in some way advocating for their health. So you'll see this person has a connection request from Fred, and I'll go through and I'll accept it. And what that will do then is allow the user who is accepting the connection to also provide access to certain levels of their chart. So if Dave thinks that Fred could be helpful in his health journey, he can give him access to certain parts of his personal health record. However, if he thinks that there's no real value in connecting with this person and providing, or there's no real value in providing this individual access to any health information, then they can just simply go and accept the connection without providing them any access to their health data. So I'll just scroll up and just give you another quick overview. So you'll see here now Fred has been added into this person's network. And if he were to click on Fred, there's a level of information that Fred has given this user access to. So they can now go through and say, for example, click on allergies and be able to add something on behalf of Fred. If they were to go back to their own account, just wanted to show two more things before passing this on for the clinic app show. So there's the profile view, which is essentially some demographic information and information for health insurance numbers and emergency contacts. This information right now does not go back into Oscar, so we haven't allowed two-way communication per se with data integration, but there is the two-way communication for secure messages and for any health trackers that the user has permitted their clinicians to access. And then settings are just really administrative settings for the account. So there's password management, there's preference management, and then any data synchronization for any clinics who have enabled automatic data sync. So there is the ability for clinics to enable automatic syncing of data into PHRs for their patients in case that is something that's of interest to them. We've made that available, but currently we've noticed that primarily clinics are doing the data, they are sending the data upon review of the clinician. So I just got another message which says, are there email notifications of new messages, not just new documents? And yes, there are email notifications of new messages. That's available within the messages setting. So when I click on messages, there's a messaging setting button and it says, send me a notification when I receive new messages. So thanks for pointing that out, because I don't think I had reviewed the screen. And then users also have the ability to put on an automatic reply, and this is both patients and clinicians. This has mostly been entered in for actually clinical use, because many times where clinicians are away on whatever the reason that they are away, their patients are notified that the clinician will not be responding to messages within a certain amount of time. So they have the ability to use this also. So this is everything that I wanted to show on the personal health record patient experience side. And if there aren't any specific questions about the patient experience, I will flip this over to Jay so he can show the clinic application. So Jay, I've passed the presenter role to you. It's just telling me that it's waiting on you to accept it. So you know what, actually, while we're waiting on Jay, what I will do is show you the integration points from the clinician side, so we can look at the clinical Oscar PHR integration experience, and then hopefully by then I'm able to do the presentation transition. So I just wanted to show what the clinical experience within Oscar looks like with this PHR integration. So as a clinician who has integrated their Oscar account with their PHR account, I'll get a little PHR tab, which is available on the scheduler screen. And if a clinician has not enabled this, what they would have to do is they would have to go into preferences and scroll down, and it will say set PHR login ID. So once they click on set PHR login ID, it'll prompt them to enter in their username and their password for their PHR, which, as I said earlier, they would be getting through the clinic application. And they only need to log into it once, and their user ID is saved with their Oscar account. So once that's done, the user will then have a button that says PHR, and if they were to click on that, it's actually all of their secure messages. So you'll see here there's a list of secure messages that John Henry has received from a specific, his patients. And then if they were to click on a specific note, they can actually put this in their e-chart. So if they thought there was something valuable in what the patient had written, they can click on paste into eChart, and that would get copied in here. So I'll just, while we have the eChart open, just go through the touch points that are existing within here. So if I were to click on prevention, you'll see if the patient has a personal health record account and the clinic user is connected to their personal health record account, they will send a Send to PHR button. Otherwise, this won't exist for them. So if there is a Send to PHR button, there's the ability to send any information that exists within this module. And currently, from the preventions, only immunizations will go into the patient's personal health record. And so I'll actually pull up a patient that has some more information so we can see what the data transaction looks like. We look at medications and allergies. The workflow is very similar, where they click on allergies and there's a Send to PHR button, which would then send any allergies that are available for this individual, active and inactive. So it will send both or all. There is the medications module that also has the Send to PHR ability. So if there is a list of medications that a clinic would like to share, they can send that to the personal health record. The other places that this is integrated is within the eForm. So if we were to click on eForms, the user, for any eForms that have been filled out by the clinician, they can send all of those to the personal health record, or specific ones, and we've seen use cases of lab requisitions go to the PHR directly if the patient can't make it into the clinic, or we've been able to see certain consultation or referral notes that have been able to be shared with the patient in that format. Documents, again, very similar, where there's a list of documents that can be sent to the personal health record. Very similar to the workflow that was just presented for the eForm. So there's the Send to PHR. There is also the ability to send lab results. So lab results can be sent directly from within the lab results, and this is also available within the Sorry, I briefly just cut out there. The lab results can be sent directly from within the lab where it says Send to PHR, and this is also available for a lab result that is opened up in the inbox. So once a lab result is being sent into the PHR, the clinician also has the ability to add in a specific annotation that would then go in as a secure message into the personal health record, as well as an annotation, so the user gets it in a few spaces. And then you'll notice there is on the bottom left-hand corner a PHR button. So what this allows the clinician to do is directly from the eChart, if they need to send a message to the user, they have the ability to send a message to the user. And if the clinic has not permitted this user to send messages back, they have the ability to add a patient's relationship, which would then allow Norman Bates to send a message back to this individual. And then if they were to click on PHR, it would actually launch them into the individual's account. So it would give them a portal view into what Norman Bates' account looks like. And this would also allow them to see any information that Norman Bates has authorized them to see. So you can see here there's not much that they have authorized them to see, but providers do have the ability to write into a patient's account even if a patient hasn't given them full authority to view their information in their personal health record. So we've got blood pressure, height and weight, and blood glucose. And clicking on this will actually present some information that is integrated information from within the personal health record for the patient. So if a patient has been capturing blood pressure information and the provider wants to have a quick look at it without launching into their personal health record, they could do so by clicking on blood pressure, which would allow them to flag any patient data, patient captured data, but that information is not stored within OSCAR, so it is differentiated. It does still sit in the PHR database. And what I will also do is quickly switch over to the new interface and just point out where the similarities are, just so everyone's familiar with both sides. So if I were to go into the new interface and type in Norman Bates, I'll be presented with their new eChart, which also has a PHR tab. And in here, there's the ability to view blood glucose, blood pressure, height, and weight. So essentially what that will show them is any information that the patient has entered in to their PHR without needing to log in, without needing to launch into their PHR, and obviously the ability to open a record, which works very similarly as the previous eChart that I had shown, and sending a message, which also works very similar to the previous one. And you can notice there's actually, you can attach files as a clinician. So if there's something specific that the clinician wants to add to their message, like a resource or a pamphlet or a PDF of something, they have the ability to do that. And then going back into the patient summary, all of the preventions and some of the other, well, actually all of the other areas are retained. So for example, if I click on preventions, it will launch me to the screen that I had originally shown of the ability to send this information into the PHR, and all the other touch points are retained. So I just got another question, and the question is, are all relationships individual to individual, or are there individual to clinic relationships? For example, can it be configured that any physician or admin staff within a clinic has the ability to communicate with a patient? The answer to that is yes. The relationships don't necessarily have to be individual to individual. We've, with the clinic app, actually modeled a patient to be able to be connected to a clinic and send a message to general clinic admin as opposed to a specific provider. So this is all for the OSCAR side integration. I'm going to try passing on the presenter rights to Jay one more time so he can, in the last few minutes, take you through the clinic app, and then we'll probably leave about the last 10 minutes for any specific questions that you may have. Actually, while we're waiting on doing the transition, if there are any other questions, feel free to either type them out or have them be presented on the chat, and I'll try to answer them while we're still waiting. I think I saw a question come in that asked, has this been through a TRA? Yes, we've been through both a privacy impact assessment and a threat risk assessment. Yes, the PHR is ready for onboarding today, both OSCAR 12.1 and OSCAR 15. And it is available to, so it's available for anyone running the last version of OSCAR 12.1 and the newest 15. So Jay, I'm not sure if you are speaking while you're doing this, but I can't hear you.
Can you see my screen?
Yes.
Okay.
Now I can hear you.
When I tried to take the presenter role the last time, it asked me to upgrade.
Well, that's okay.
But it seemed to work this time.
Perfect.
So I'll first show, this is the Clinic PHR kind of booking configuration tool. When you first log into it the first time, it will look like this. Will ask for your external OSCAR URL, a username and password for an actual user on the OSCAR system. And then you'll test the connection to make sure that it can connect. After that, when you log in, it will look like this. So this shows the clinic title, address, hours of operation, where you can add as many lines to as you want, the clinic phone number, and all of this appears inside the clinic app that Anuba had just shown. There's more search parameters down here, data search ahead limit. So how this works is how hard it hits the OSCAR server. So it will try to search for 10 days before giving up and asking the user if they would like to search again, or the number of appointments. So if it finds 11 appointments tomorrow, it doesn't search any more days, it just returns. So this keeps the load off the OSCAR server. A number of minutes appointment must be booked in advance. So this limits how many minutes. So it's like a plane. You can't book a plane that's going to take off within under an hour. Same idea. And the time zone that the appointments will be shown to the patients, Toronto or Vancouver. Under here is providers accepting online booking. So right now, this is just a test OSCAR. So I have OSCAR Doc and Dan Dalton. I can add team members. So a doctor, the booking is linked to the MRP. So when a patient logs in to book an appointment, based on their MRP will be which providers they can book for. So right now, this is just connected to OSCAR Doc, but I could add another team member, say Adam Arquette, as part of the team, and configure that Adam only does allergy injections in 15-minute appointments. So these are the slots that you would normally see in OSCAR, 1, 2, 3, same day. I can check off that. If there's a different duration that I want this type of appointment for this provider to have, say it's a resident where another provider might do it in 15, but I want to make sure that they take 30 minutes to do it, so 30 minutes or 30-minute appointments, I can override that there. From the grid, I can see that OSCAR Doc is seeing prenatal appointments in 1 and S code appointments, not feeling well in 1 and 2 and S code. not seeing discharge follow-up or prescription renewals. Down here you control what's actually in this grid. So prenatal, I'm not feeling well, discharge follow-up, allergy injection, prescription renewal, those are the headings that appear on these. To add another appointment type, you can just click on there, and these are the ones that are currently being pulled from the OSCAR server. So if they have appointment types, they can just add the ones from the OSCAR server or a custom one. Appointments, these are the codes that are being used. So these are being pulled from the OSCAR server, and which ones you want to make available for online booking. Now, they don't all become available for online booking. They still have to be configured up here for which provider sees which code that you're using for online booking. Open access codes, so here I had the 15-minute appointment. That one's not correct, but same day, 15-minute appointment. This will make this code only available within 24 hours of its becoming available, or booked within 24 hours of it, the appointment time being right now. Add provider account. This makes it easy to add providers to the clinic. So right now you can see which doctors have OSCAR account or or PHR accounts. I can see this one's linked to my test one. If I wanted to create an account, I can just create there, enter a username, city, province, date of birth, email, and save. And I will get a document that looks like this. And then you can print that out to give to the provider to log in. Manage news. This appears in the PHR as news items that appear on the home page and under the clinic's own page. Test appointment search. This you can use to debug if a demographic is saying they can't book an appointment online. So I can check OSCAR doc, the appointment type, I'm not feeling well, and then search to see should there be appointments available. So here I can see that OSCAR doc has 28 appointments based on the codes that we've configured for them. So the 2s are connected in here because it's 1, 2S. Future appointment filter, so it's getting filtered out right now because I have it set to 88 minutes ahead. Open access filter, so it's filtering out anything within 24 hours. You can see here that it's getting cut off at 2 because of that filter. Sorry if I'm jumping around, that might be confusing. The existing appointment filter, so if there's already an appointment booked in these slots, they'll be removed. And then the multi-unit filter is when, say here in this 10 a.m. to 10:15, if there's a 30-minute appointment, it knows enough to filter out the 10:15 one because there's not enough time. It has to be at the 10 o'clock spot to be booked. Any questions on that? Doesn't look like. And these are all, when you change them, they change real time. I'll hand it back to Anuba.
All right, wonderful. So we've got about 8 minutes remaining, and I believe for the next presentation, we do have to switch links. So if there are any questions, we'd be definitely happy to take them now. Otherwise, we can use the time to transition into the next meeting. So the clinic admin staff messaging interface, that would still be available from within OSCAR. So when an administrative staff member logs in to OSCAR, they will actually just receive their messages in the PHR tab. So instead of logging in with their personal account, like you could see here that John Henry has logged in with his personal John Henry physician account or doctor account, the general clinic administrative staff can log in with their general clinic account and receive the messages there. Does that answer your question, Keith, or was there something specific that you were interested in seeing? Perfect. So if there are not any more questions, what we will do is use the next few minutes to transition. Oh, never mind. There is another question. So I've got two questions. I'll finish up Keith since it is a follow-up, and then I will get into the PHR messages setting. So can MDs view incoming messages for other MDs? I don't believe so. That is not anything that has been developed to date, but that has been something that we have looked at wanting to integrate further and develop further on. So right now the answer is no, a physician cannot look at another physician's messages. But in a team-based environment, we do recognize that that will be something we need to accommodate. So we will be working on that. The second question was, interim workaround. Currently, the only interim workaround that I have seen is when a patient sends a message to their clinician and the clinician's auto reply says that they're not responding to messages, the patient would then actually message the general clinic account and the clinic can triage from there. So that actually links well to Ben's question about clicking on the PHR message settings. So if I click on the PHR message settings, what this will do, that's not what I wanted it to do. But what that, where that actually launches me to is, if you recall in Kindred PHR, it's the same message settings as here. So what that will launch me to is a place and space to send an auto reply. And what the clinician can then do is put in their auto reply that their patients are notified that they're not tending to messages. So what that will do is, if a patient sends a message, they will receive a notification that the clinician is not receiving any messages or responding to them at the moment. And then the patient can choose to either follow up with whoever the clinician has left as their backup, or with the general clinic account. So just received another question specifically about, is there any way to limit messaging to avoid spamming the physician? So the answer to that, I probably have a partial answer to that. Currently, physicians can send patients messages pretty freely, but they have to allow patients to message them back. So I don't know if you recall earlier in the presentation when I was sending a message to Norman Bates, they actually didn't have the permissions to send me a message back, and I enabled those. If there are patients who are spamming the physician or patients who are abusing the privilege of being able to secure message, the physician can definitely take away their privileges of messaging. So we haven't put a number on how many messages a patient can or a physician can receive from a patient, but we have given physicians the ability to disable the permissions of a patient messaging back if they choose.